Hello, my name is Dominica Lema, and today I go to tell about renal complication of hematopoietic-cell transplantation. Definition: hematopoietic stem cell transplantation is of the correct potential in treatment of bone malignant and normally disorder of lymphohematopoietic.
Here, so it's nice to get a little break from the deep freeze that we're having in Minnesota, although the weather isn't that great here either, but it is nice to get a little break. So today we're going to talk about renal complications, acute and chronic, in the setting of hematopoietic stem cell transplantation. As you can see, renal failure is not the same depending on the type of hematopoietic stem cell you get. For autologous stem cell transplantation, those patients actually experience much less of acute renal failure. And there are multiple reasons for this, which we'll go over in a little bit. The highest rates of acute renal failure actually comes in the allo patients. As you can see, even by grading that grade 1, nearly half of the patients may experience some grade 1 renal insufficiency, which is defined by less than doubling of their serum creatinine. And grade 4 is up to 4%, which is dialysis. Now, some of the reasons behind the differences that we see is based on the diseases. So patients who undergo auto transplant mostly are myeloma patients, amyloid patients.
Applications in medicine. It has been associated with the development of both acute and chronic kidney failure. Renal is a very important cause of morbidity and mortality peri-transplantation acute renal failure. This is common in costing and unraking dialysis is associated with extraordinarily high mortality. Pros and cons. It is a great group of lymphohematopoietic because it's an efficient. The percent of renal failure is high and chronic kidney disease occurs in 20% of cases.
Hematopoietic stem cell transplant electrolyte concerns by Dr. Michelle Lee.
My name is Michelle Lee, and I will talk to you today about bone marrow transplant specific electrolyte issues.
Case 1, hyponatremia.
The nurse pages, the patient's sodium is 127. It wasn't that low yesterday. Can you come to look at him? In your mind, you consider the causes of hyponatremia. Acute causes could include an errant result, IV fluid or parenteral nutrition or medications, volume depletion, third spacing, or SIADH. You also consider chronic causes like renal wasting and water intoxication. Questions to ask on the phone or to look up. What phase of transplant is the patient in? Is the patient undergoing conditioning, receiving high-dose chemotherapy or immunosuppression? Has the patient received the stem cell infusion today? Are the patient's counts in the process of falling, or is the patient awaiting engraftment? Has the patient already experienced the acute toxicities of transplant and is recovering, approaching discharge, or is this a patient who's been readmitted for infection, graft-versus-host disease, or dehydration? Knowing what phase of transplant the patient is in can help you understand why the patient should have hyponatremia. Other questions to consider for the patient: has the patient been urinating normally?
Issue applied in Ecuador. In Ecuador, this is of transplantation, but how will kidney failure persons perform in this case?
I concentrated on 3 separate kidney conditions that are seen in multiple myeloma. The first one is light chain cast nephropathy. And as I alluded to earlier in the talk, cast nephropathy is a myeloma defining event. And in fact, in 2014, the International Myeloma Working Group specifically defined light chain cast nephropathy as a myeloma defining event, and in fact made it exclusive so that other renal lesions that are commonly seen in multiple myeloma can coexist with multiple myeloma, but they are not myeloma defining events. And what the one thing that we have learned over the years is that serum free light chain is a diagnostic marker for cast nephropathy, so that the
Conclusion: the rising number of transplants coupled with an ingrained factor of older skin patients being transplanted means that relapsed renal toxicity will remain an important complication of this life-saving procedure.